Upper eyelid surgery. Over the years, a person's eyes may change, with the eyelids becoming sagged or drooped, and have an overall puffy appearance. These changes occur for a number of reasons, but are generally due to sun damage, stress, and genetic factors. These changes can make a person appear older than they are, or make someone look tired or sad. Eyelid surgery can reduce heavy, sagging eyelids as well as making the eyes look less puffy. Eyelid procedures involve the removal or distribution of fat pads and the removal of excess skin and tissue to rejuvenate the eyes. All of these procedures may be performed without an overnight hospital stay, depending on your surgeon's preference. Similarly, all of the procedures may be performed with either a local anaesthetic, often with sedation, or under a general anaesthetic. Your surgeon will discuss what options are suitable for you. Eyelid surgery is commonly combined with other facial procedures such as a facelift. Before discussing surgery, it is important to understand your anatomy. The eye sits in a bony socket padded with fat. The fat layers are separated by a membrane or septum, which may weaken or sag with age. Directly behind the thin skin of the eyelids are muscles. There are 2 fat pockets in the upper eyelid and 3 fat pockets in the lower eyelid. In front of this and the membrane holding the fat is the muscle layer, which controls eyelid closure and causes wrinkles around the eyes. Before surgery, the skin is thoroughly cleansed. The surgery can be performed under local anaesthesia or general anaesthesia. The area to be operated is outlined with a surgical marker, and a crescent-shaped piece of skin is removed. The surgeon may also remove a thin piece of muscle if required. If there is excess fat, the septum or membrane may be opened and gentle pressure used to reveal the excess fat that needs to be trimmed. The incision is closed with fine stitches, leaving a fine scar in or parallel to a skin crease. There will be some initial discomfort after your surgery, and some minor bruising and swelling is to be expected. You may be asked to use eye drops, and it is important to rest for the first couple of days. Recovery is usually rapid, and most people are able to return to work in a week or so, although you should avoid heavy exercise for about 2 to 4 weeks. Whilst complications are not common, all operations have some risks. There is a small chance of infection or bleeding, and it is possible to have an over or undercorrection, which may require further surgery in the future. Much rarer risks include double vision, asymmetric eyelids, and impaired vision. Explore the safercosmeticsurgery.co.uk website for information about choosing your surgeon, questions to ask during your consultation, and safety.